over to you, Dr. Sumlata, you can start.
Good afternoon, one and all. So today's my topic is cataract surgeries postponed on the day of surgery, which we have already selected them, and on the day of surgery they got cancelled. So it's a small pilot study. So why I have done this study? Because it is a point of interest in tertiary care hospitals. Ours is a tertiary care hospital where we bring lots of cases through camps or through OPD, whatever it is. We bring post cases, about 30 to 35 cases, and among them on the day of surgery at least 5 to 7 cases will get cancelled. So to avoid all this, just we had made a study so that we can streamline our cataract surgeries. So aim of the study to evaluate and report causes for cancellation of cataract surgery on the day of surgery in patients posted for surgery. So why we need to do this surgery? When a case was cancelled, money is potentially wasted on unnecessary setups while doing camps, bringing the patients to the hospital, doing all preoperative evaluations. Our postgraduates will be doing lots of work, preoperative investigations, slit lamp examination, everything. And to prevent a negative impact that a case cancellation has on the patient, relatives and staff, cancellations also have potentially severe financial implications on hospital operations. So improving the proper preoperative systemic evaluation of cases and preoperative proper ophthalmic examination definitely will reduce postponing the cases on the day of surgery. Implementations of quality improvement strategies have also been shown to decrease the cancellation rates. So our main objective of this study was to assess the reasons of cancellation of cataract surgery, identify the modifiable barriers to complete the surgery on the day of scheduled date, and educational experiences for the postgraduates that are lost as a result of cancellations. So it is just an analytical observational study, which is the duration is from September 21st to December 2021. So it's ours is a tertiary care hospital. So ethical considerations, the study was done after obtaining ethical committee clearance. So these are the inclusion and exclusion criteria. We have taken the consent from the patient and we don't have any financial interest. So first camps were conducted according to the schedule, every month there will be a schedule. Patients were shifted who are prior seen by postgraduates at camps, and they were shifted to the hospital. Thorough history will be taken by the postgraduates, slit lamp examination and will be done by the senior residents. Preoperative investigations were conducted on the day of admission itself. So at this stage, some cases were cancelled due to some acute anterior segment pathologies or some abnormal investigations like increased intraocular pressures, or there is some vitreous or retinal pathologies. So we started out few cases here in every camp. So after that, admission was done at this stage. Systemic evaluation will be done on the next day of the admission. So patients with abnormal systemic values or abnormal systemic conditions like cardiac history or any high hypertension, all those cases will be sorted at this stage. After admissions, all these patients were sent back to their places without doing surgery. So remaining patients were posted on the surgery. So on the day of surgery, most of the cataract surgeries were cancelled, mostly due to increased random levels or diabetes or due to increased blood pressure. So it's a simple descriptive analytical study, so not much to do with any statistical analysis. We have just taken the percentages. So total 625 cases were done during the period of 4 months. Among them, 94 cases, a percentage of 15.04 were cancelled due to various causes. So among this, the most common is RT-PCR positive, because during that time it was a COVID period, and followed by diabetes is the most common cause for cancellation of cataract. So other special conditions are one case on table, it was cancelled because of scleral perforation, which was done by a postgraduate, and also retrobulbar hemorrhage is one more common cause. So this is the month-wise distribution of cancellations, and this is also the male and female preponderance of cancellation of cataract surgeries. So case cancellation is defined as those procedures that were cancelled either on the day of surgery that was scheduled or the previous day, or cases that appeared in a definitive schedule list that ultimately were not performed. So an efficient ophthalmic service should have a low rate of cancellation of cataract accordingly, but most of the cases were cancelled. Schofield and colleagues who examined data from an elective surgery performed at a major hospital found 17.1% of cataract cancels, and Henderson and colleagues about 24%. So our limitations or estimated facility and financial implications were not included in this study, and this preoperative pre-admission testing is very, very important if you want to just reduce the cancellation rate.